adult daycare visits, and more than 4.1 million hours of home support. Island Health has expanded our primary care services with same-day access to primary care at 3 urgent care clinics, 7 urgent and primary care centers, 2 community primary care clinics, and 1 after-hours primary care clinic. Under the leadership of 8 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments each year. From before birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
Good evening, everyone. It's lovely to see you here. And I'll just say that I'm chewing gum and sucking a cough drop because it's allergy season. So if things go sideways, well, we'll figure that out. I'm Leah Hollins, the chair of the board of directors of Island Health. And I have to say, every time I see this video, it makes me feel great about the services that we provide. On behalf of my colleagues, welcome to our public forum. Whether you are joining us here in person at the Khowutzun Heritage Center or online through our live stream. Before we get underway, I acknowledge with respect and humility the traditional unceded territories of the Cowichan tribes and the neighboring nations of Stunamus, Layakson, Penelakut, Halalt, and Malahat First Nations. We also acknowledge that we serve the communities of Didadat, Patchesat, and Tsuba-set. And we recognize the Inuit, the away-from-home urban Indigenous people, and the Métis chartered community. And I'm delighted to invite Chris Alphonse, a member of the Cowichan tribes and a council member for the past 6 years, to come up here. He currently serves as deputy chief, representing the nation when Chief Daniels is unavailable. Chris is a father of 6 and a grandfather of 7, and he lives with his family on the Cowichan tribes land, and he's going to welcome us. Thank you, Chris.
Hajka Leah. Hajtepka Siam Nasea Tanaquel, Limo Si Atala Siam Nasea. Hajtepka Siam Nasea Quansialap Tatesel Tanaquel. Thank you all my relatives for coming forward. Hajtepka Siam Island Health Mistimo Tanaquel, Limo Si Atala at the Khowutzun. Really grateful for the Island Health people working so hard for our people. Klimosi atala siemnasea tinitsan at Khowutzun tamoch. Really grateful for everybody to come here on the unceded territories of Khowutzun tribe. Thank you all. Haichka.
We appreciate you being here with us today, and I'm grateful to you for welcoming us as visitors to live, work, play, and care within Cowichan tribes and neighboring nations' lands. We do this to reaffirm our commitment and responsibility to improving relationships between nations and cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done, such as the cultural genocide and assimilation of Indigenous peoples. the residential school system, and the discovery of graves of Indigenous children who attended them, the too many missing and murdered Indigenous women and children, and the social inequalities and racism which exist today. I invite you to reflect on our responsibility to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility. We demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and the ongoing impacts of colonialism. Public forums like this allow the board to meet people and communities we serve and are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been at the center of my work. I always ask myself, is what we are doing right for the patient? Caring for patients is why I started working in healthcare, and caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's my pleasure to introduce you to our board of directors who are responsible for Island Health's overall direction. In addition to myself, the board includes Ron Rice, a member of Cowichan tribes who lives in Victoria, Shawnee Cassavant from Hupetchesset and Sechot First Nations, Anne McFarland from Victoria, and Harold Cull from Colwood. Unfortunately, 3 of our board members, Dr. Morgan Price, Joanna Gislason, both from Victoria, and Andy Adams from Campbell River, couldn't be here tonight. So we have a very full program this evening. Interim Medical Health Officer Dr. Melissa Wan will speak about regional public health and wellness. We will hear from our Cowichan Communities Health Network, which will share the impactful work they are leading to bring partners together and advance a collective community-driven approach to health and wellness across the region. And the last part of the agenda will be an opportunity for you, community members, who have attended our meeting or submitted questions by email in advance to ask those questions. And I'll open up the floor then so the board can hear from you. First, though, Island Health's President and CEO, Kathy McNeil, will provide an update on the delivery of health and care services across Vancouver Island and the Cowichan Valley. Kathy?
Thank you, Leah, and good evening, everyone. I would like to extend my thanks to Chris for opening us up in such a good way and for your hospitality and welcome to these beautiful lands. We have so much to learn about how to partner in a good way with the First Nations on whose lands we serve. And the work that's been done here in Cowichan Valley is just inspiring. And especially as we look to the new hospital that's being built and the wonderful partnership and I think walking together that's been done here locally. It's just a wonderful thing to witness. It's a privilege to be here tonight. It's always nice to be able to get into community with community, the people that we serve. And here in Cowichan Valley, we know how important health and wellness is to the people here in the valley. We know that health is not something that's owned by the health authority alone, that the health of a community is very much about how the community comes together to support each other and the many partners that are all part of health and wellness in the communities across Vancouver Island. We know by working together and bringing the resources that we have together, we can create healthier, stronger future for everyone who lives in these communities. Often when people think about health, they think about hospitals or emergency departments, physicians, nurses, people in lab coats. I was thinking in the video how much we show our hospitals, actually. And those services are absolutely critical, and they're so important, especially when we think about life and death and trauma and emergencies. And yet, decades of research has shown that health is shaped by so much more than what the healthcare system can provide alone. In fact, only about 20% of health status is determined by clinical care. The rest is shaped by the social determinants of health, the conditions in which people are born, grow, live, work, and age. Factors such as stable income and employment, safe and affordable housing, access to education, strong social connections, community safety, and access to nutritious food and opportunities for physical activity all play a critical role in helping people stay healthy and manage their illness. Broad social and economic conditions affect health more than medical care, so partnerships across communities, governments, and organizations are needed to strengthen well-being of communities. These factors shape whether someone can recover from an illness and whether they can age with dignity and independence. The Cowichan Valley is a diverse geography and home to nearly 89,000 people. This region has a strong Indigenous population, with almost 14% of residents identifying as Indigenous, which is a higher proportion than other communities across Vancouver Island, where the average is about 8%. The population here is also older than the provincial average. About 25% of the residents here in Cowichan Valley are 65 or older. Demand for services from primary care to home and hospital support we know will continue to grow. Like many communities across the country, this region also faces higher rates of chronic conditions such as heart disease and diabetes. These challenges are often connected to the impacts of residential schools and broader social and economic realities. 10 to 13% of residents in the Cowichan Valley live in low-income households, affecting housing stability, nutrition, transportation, and access to care. And these realities shape health outcomes long before someone arrives at a hospital or a clinic. Today, at the center of the region's healthcare system is the Cowichan District Hospital. Today, the hospital continues to care for a growing number of patients in a very old, aging infrastructure. On average, about 157 people are admitted to the hospital each day, or are in the hospital each day. Roughly 7 more each day than this time last year. Even with ongoing demand pressures, we're seeing a small decrease in emergency department visits, which are down about 5% this year. That works out to roughly 4 fewer patients per day, with about 32,000 visits expected this year compared to just under 34,000 last year. And we're very hopeful that part of this reduction might be attributed to the opening of the new urgent and primary care center that opened here in the fall. The hospital's teams are also performing about 6,500 surgeries this year, which is slightly more than last, with nearly 3/4 of procedures completed as day surgeries. That improves access and allows patients to return home the very same day. We're always exploring new ways to deliver care. The Hospital at Home program was launched in April of 2024, and it allows some patients to receive hospital-level care in their own homes, helping people recover in familiar surroundings while freeing up approximately 4 hospital beds a day for those who need it most. We recently had some feedback from a family whose loved one received care through the Hospital at Home program here in the Cowichan Valley. Not once, but twice. They shared how reassuring it was to bring their loved one home, how the nurses checked in multiple times a day, how supported and confident they felt every step of the way. What stood out to them most was not just the clinical care, but the sense of comfort, dignity, and peace it brought during a difficult time. For decades, the hospital has been a cornerstone of care for the Cowichan Valley. Every day, physicians, nurses, and allied health professionals provide emergency services, surgery, maternity care, diagnostics, and inpatient care for thousands of residents. And it is so exciting to see that that aging hospital is being replaced by a state-of-the-art facility. In November 2025, the new hospital was named Khowutzun Valley Hospital, in the English name, paired with the Hulkaminam name, Khowutzun Halitneuth. The Hulkaminam name was gifted through elders working on the project's Language and Cultural Teachings Advisory Group in partnership with Island Health. Khowutzun is the Hulkaminam spelling of Cowichan, and Halitneuth means place of giving life. Together, the name means Cowichan, place of giving life. Island Health is so humbled and grateful for the generosity of the Cowichan tribes and the committee in gifting the new hospital this name. And we commit to upholding culturally safe care for all who enter this building. The hospital is being funded by Island Health, the province of British Columbia, the Cowichan Valley Regional District, and the Cowichan District Hospital Foundation, and is being delivered by our construction partners in the Nutsumat Alliance. At the peak of construction, nearly 1,000 workers were on the site, many from Vancouver Island, along with apprentices and trainees gaining valuable experience. Community voices have also helped shape the project, including staff, physicians, patient partners, and representatives from the 9 local First Nations and the Cowichan Valley Métis Nation. This project was recently recognized for excellence in evidence-based design. The Center for Health Design's Touchstone Gold Award highlights Cowichan's future hospital for prioritizing safety and well-being, using proven research to reduce patient falls and staff injuries, strengthen infection prevention, and improve workflow while supporting the health, efficiency, and resilience of care teams. Construction has come a long way since the site was prepared back in January of 2023. And I'm pleased to say the project remains on budget and on schedule, with the building expected to be substantially complete later this year of 2026. Once construction is finished, Island Health will take possession of the building and begin preparing it for opening. The hospital is currently scheduled to be open to patients in late spring of 2027. When the new hospital opens, the current site will be closed and secured. And while we have no approved plan or funding for its future use today, we continue to work with our ministry partners to determine what comes next. As grateful as we are for this beautiful new facility, one of the most important changes in healthcare today is the drive to deliver more care outside of the hospital walls. In the Cowichan Valley, Island Health and our partners are expanding community-based services so people can receive care closer to home and earlier, before concerns become emergencies. Community health teams provide a wide range of supports, including home care, rehabilitation, chronic disease management, mental health supports, and palliative care. Here in Cowichan, our home support team helps more than 600 people stay at home, delivering more than 32,000 visits a month, and it's about 700 to 850 hours of care every single day. On average, depending on client needs, patients receive 30 to 120 hours of care per month, allowing them to live at home with autonomy and with safety. Primary care is a critical part of this community system of care. We thank the Cowichan Primary Care Network, which was launched in 2020, bringing Island Health together with family physicians, nurse practitioners, First Nations partners, and community organizations to strengthen access to primary care. The network includes 4 Island Health-operated clinics: Ladysmith Family Practice, the CareBridge Clinic in Duncan, the Khowutzun Clinic in Lake Cowichan, and the Cowichan Urgent and Primary Care Center here in Duncan. These clinics work closely with the Provincial Health Connect Registry, which matches people without a provider to available physicians or nurse practitioners. In Cowichan, about 10,000 residents are currently registered on that registry, and recruiting new providers remains a key focus for the network and for the community. Today, Cowichan has one of the highest primary care attachment rates on Vancouver Island, with 84% of residents connected to a family doctor or nurse practitioner. Most of the other communities across the island are about 75%, so you're winning. This reflects strong progress and partnership, while recognizing that more work is needed to ensure everyone has access. Another important step forward was the opening of the Cowichan Urgent and Primary Care Center in October of 2025, providing same-day care for people who do not require emergency services. Since opening, that center has provided more than 5,300 patient visits, helping people access timely care and reducing pressure on the emergency department. This center includes a broad team of family physicians, nurse practitioners, nurses, mental health clinicians, social workers, and peer support workers, reflecting a whole-person approach to care. In Chemainus and Ladysmith, urgent care centers see close to 100 patients a day, helping reduce pressure on emergency departments at both Cowichan District Hospital and Nanaimo Regional Hospital. And I've heard we have patients now driving up to these clinics from the western communities in the South Island who want to reduce pressure on that very busy Victoria General site as well. Looking ahead, the Primary Care Network will continue to focus on recruiting and retaining physicians and nurse practitioners, expanding services at the Urgent and Primary Care Center, and strengthening access in rural communities such as Lake Cowichan. The network also remains committed to working in partnership with First Nations, Métis, and Inuit people to support culturally safe, community-led care. Together, these efforts are helping build a system where more people can access the care they need, when they need it, and as close to home as possible. Another priority for the region is strengthening mental health and substance use services. Today, people can access counseling and psychiatry in Duncan or through virtual appointments. Same-day appointments are available through the Rapid Access Clinic, providing timely, low-barrier access to assessment, brief support, and connection to ongoing care, helping people get the right support when they need it most without long waits. At Cowichan District Hospital, crisis response services are embedded in the emergency department, ensuring people experiencing mental health or substance use challenges are receiving immediate care. In the community, we have assertive community treatment teams, who are outreach teams that help individuals with complex needs receive care where they live. These teams provide clinical care and also support people with housing, employment, treatment, and community connections. We've recently introduced a phone line called Access Central. It's a single point of entry that makes it easier for people to get timely addiction care, connecting them to same-day assessment, treatment options, and ongoing support through one phone call, and helping ensure people can access the right care at the right time without having to navigate what is a very complex system. It's a new service, and as the volumes and calls continue to grow, we're actively working through the associated pressures and refining how it operates. And if you want more information on Access Central, there are handouts at the welcome desk where you came in that has the phone number as well as all information associated with that service. Together, these initiatives are strengthening pathways to recovery and long-term stability. None of this would be possible without the people who deliver care. Recruiting and supporting healthcare workers will always be a top priority for our organization in every community. Over the past year, 45 medical providers were recruited to the Cowichan area, including 43 new physicians and 2 nurse practitioners. Of those, 34 of them joined Island Health associated clinics or programs across emergency care, family practice, hospital care, and key specialties, and 11 were recruited to community-based clinics. This reflects strong recruitment progress as we continue to build and sustain the workforce needed to meet growing demand. Recent changes by the regulators, including the College of Physicians and Surgeons of BC and the BC College of Nurses and Midwives, has also helped support international recruitment. And since those bylaw changes were introduced, Island Health has recruited 40 physicians, 12 nurse practitioners, and 67 nurses, all from the United States. Of these, 9 physicians, 5 nurses, and 2 nurse practitioners have been recruited specifically to the Cowichan Valley from the US, with additional candidates currently going through interviews. We are always recruiting, and the new hospital, with its larger footprint, will require more hands to help. Recruitment efforts continue in 2026, and we're participating in several national and international conferences to attract specialists to the region. These efforts help ensure communities like Cowichan have the skilled professionals needed to provide compassionate, high-quality care close to home. We can do the recruitment. Communities demonstrate the hospitality. The people want to come and make this a place to live. As we look ahead, one thing is clear. The future of health depends not only on hospitals, but on the strength of our communities. It depends on how we support healthy aging, improving mental health, strengthening housing stability, and ensuring young people have opportunities and connections. Because health begins where people live, in our homes, in our schools, in our workplaces, and in our neighborhoods. And that's why strong partnerships with First Nations, municipalities, community organizations, and the residents who live here are so important. I want to close by thanking the staff and the teams here in the Cowichan Valley for their unwavering dedication, compassion, and professionalism, many of whom are here in the room with us tonight. Every day, you show up for patients and families in the moments that matter the most, often in challenging, fast-paced environments, often without the resources that you wish you had. And your commitment to delivering safe, high-quality care does not go unnoticed. Your hard work, teamwork, and resilience are what make a real difference in the lives of the people that you serve. At Island Health, our vision is very simple: excellent health and care for everyone, everywhere, every time. Simple, but not easy. Achieving that means listening to communities' needs, working together, and continuing to build a stronger, healthier future. I want to thank each of you for being part of that work, for being so interested in health and care in your community, to take the time to be with us tonight, and for the opportunity for us to have this discussion with you. And now I'd like to hand the meeting back to our board chair.
Thank you very much, Kathy. And it's a real pleasure now to introduce Interim Medical Health Officer Dr. Melissa Wan to provide an update on the health and wellness of the Cowichan Valley population. Dr. Wan?
Thank you so much. Just gonna get the clicker going and make sure that we're working. Oh, maybe it's not working. Oh, there we go. Great. Aikwinas Ilamna, it's good to see you and thank you for having me. My name's Dr. Melissa Wan and I'm the Interim Medical Health Officer for the Khowutzun region. My role is to report on the health of the region, and today I want to show you about our health throughout the life course. So these are just some of the headlines that you've probably seen in the news or maybe that you've lived through. A really long transit strike, an outbreak affecting the community members experiencing homelessness, a precautionary boil water notice, and Indigenous leadership taking back child and family services. On the surface, they look like very different stories, but they are connected and they reflect the conditions that we live in, the systems that we rely on, and ultimately our community's health and well-being. So today, I want to tell you about the health of our community through the lens of a child born into the region. About 700 children will be born this year on the traditional and unceded territories of the Coast Salish peoples, the Cowichan, Malahat, Subasat, Halat, Penelakut, Shemanis, Laexin, Paquachin, Dididat, and Pachidat, those who have stewarded these lands since time immemorial. All 700 children are born with potential, but not every child is born into the same circumstance. History, place, community conditions, they all matter from the very beginning. So I'm going to start with the demographics of our region and our community that she's born into today. So this slide sets our context. The region is made up of 3 local health areas: Cowichan South, North, and West. Most of our members live in Cowichan South, with smaller populations in North and West. And compared to the rest of the province, our region is older and faces multiple affordability pressures, including the highest cost of essential goods like food. At the same time, our community also has the highest number of individuals identifying as Indigenous, signifying a strong foundation for community assets, leadership, and resilience. These aren't just facts, but they are factors that shape what families are navigating and the supports that they have right from the start. So now I want you to look at what's going to happen in the next 20 years. Our demographics shift, and the strongest growth is in the population over 75 years old. What this means is that there will be even less working age adults alongside an older population. That affects caregiving, service demand, and the capacity of our communities and services to support families. This isn't just a demographic shift, but it is the context that our children are growing into and what their family life will look like from the start. So her first 5 years are already being shaped in very powerful ways. A child doesn't choose her family's income, their housing, their childcare, or how easy it is to have support. But those realities are already influencing her health and her development before she starts school. These are some of the indicators that capture what families are navigating in those early years. One of these is the EDI, which is the Early Development Instrument, and it tells us how children are doing before they start school. In our most populated regions, more than 1 in 3 children are arriving vulnerable in at least one area of development. Another indicator that we look at is childhood immunization coverage, and it's lower than what we hope for. And while these just look like numbers on a screen, they are actually population health signals about whether families are getting the stability, connection, and the support that they need early enough, and whether our systems are reaching them in ways that build trust. So by the time she starts school, we've already seen some of these early inequities that she faces, and they are visible. But school is one of the places where her story can change. Schools are places that offer belonging, support, connection, and opportunity. So this is a key turning point, and one of the places where early disadvantages can either deepen or begin to narrow. And one of the metrics that we can look at is graduation rates. More students in our region are graduating, and that's encouraging, but we remain behind the province and the rest of the island. So while there has been progress, it doesn't stop here, because graduation is one of the clearest indicators of future opportunity. For her, that includes her income, stability, her health, and what comes next in her adult life. But school isn't actually the whole story. Her health is also influenced by the environment around her. The air that she breathes, the water that she drinks, the roads that she travels on, and the housing available to her family. In a valley like ours, we know that smoke lingers, so when we use our wood stoves, the exposures aren't just about individual choices, but about the geography that we live in. So these shape health in practical ways, from the respiratory conditions that our valley faces, to safety, affordability, transportation-related injuries, and how people can stay connected across such a wide and vast geography. But there are also investments underway. We have over 221 drinking water systems, and all of them have done work to strengthen resilience to climate change. These are the environments that she's growing up in, but they are also the environments that we can choose to continue to invest in. So by adulthood, what started as context, at home, in school, in the environment, now appear in her health. This is when context appears as outcomes. And an example of this at the population health level is in our substance use data. What stands out here is not one substance alone, but an elevated pattern across alcohol, tobacco, and toxic drug-related harms. From a population perspective, this isn't just an isolated clinical issue about one substance. It's a signal that's shaped by availability, policy, and the conditions in which people are living. It's also an area in which we know what works: prevention, harm reduction, treatment, and stronger upstream supports. So the importance of this slide is not just the pattern it shows, but that we know that these are harms that we know how to reduce. We can also look at the data for chronic diseases. Mental health and asthma stand out here, while the other indicators are mixed. These are preventable conditions, and they stand out because they reflect the environment that we live in. Separately, our region also shows high use of acute care services, particularly for conditions that can be managed in the community. These are just different ways of how the same upstream conditions are showing up downstream. So if we take a step back and look at what this means for our child, one indicator can summarize it all, and it's life expectancy. It's one of the clearest indicators of population health because it reflects more than just healthcare. It captures the cumulative effect of the conditions that people live in across their whole life. And what's important here on this slide is not just that life expectancy is declining, but the decline is continued and widened over time. Our region is older, we're more rural, and we're facing specific pressures in the valley. But that doesn't necessarily mean that we're less resilient. It just means that the pressures here are different and that they can leave a deeper mark on our health. So for her, the question is whether we continue to influence the conditions around her for her to live every possible year that she deserves. And when we ask our community what matters to them and what they need, these are the things that they tell us. affordability, access, well-being, and support. Those priorities match exactly what the data has been showing us, and more importantly, they tell us where we should be acting. But our child's story is not yet written. The data in this deck is not her destiny. It shows us opportunities where we can invest early, act consistently, and stay focused. We have the power to change all 700 of those children's lives born this year. And investment in these opportunities is already visible, and the trajectories of these children's lives are already changing. In the early years, we have increased family outreach, and we know that our graduation outcomes are strengthening, especially with the new Cowichan Secondary opening alongside. In the built environment, there's strong work underway on airshed management and air quality, safe drinking water, and drought readiness. And in governance, our nations are taking back jurisdiction in ways that matter deeply for intergenerational health and well-being. These are just a few of the places in our region where intentional investment and coordination are already changing the trajectories for our children. So I want to leave you with 3 takeaways. First, every slide that we've talked about today is connected. What happens early shows up later. Second, where we invest, the data moves. And third, this work belongs to all of us because the decisions we make today will shape the health of our community for years to come. So I began with a child born in this region, and what the data shows is that her health is shaped long before illness appears by income, housing, education, environment, access, and community conditions. But her story isn't fixed, and where sustained effort is made, we can see progress. So the real question we have now is, what do we want to happen next, and how do we do it together? Thank you.
Thank you very much, and thank you for summing up the way you did, because we tend to think about health as hospitals and doctors, and it's way bigger than that, as you pointed out. So really appreciate hearing from you and your colleagues. Every time we have one of these forums, we talk about population health, and I just am so grateful that you do that. Thank you. So we're now going to move to a community presentation, and it's a pleasure to welcome and introduce Cindy Lise, Regional Facilitator of our Cowichan Communities Health Network. And I just, before you get started, Cindy, wanted to point out that when we have presenters from the community, I always give the board an opportunity to ask questions of you before we go to the audience. So just wanted to make a point of that, please.
Thank you. I'm just also going to do the test. Perfect. Aitsquale, Entha, Cindy Lise, Regional Facilitator for our Cowichan Communities Health Network. And for us today, Itskapip Atanakwayal Tani Atu Khowutzun Tamauch. We are gathered here on the Cowichan land. Our Cowichan is a network of diverse partners in health, local government, community services, First Nations, and people with lived and living experiences. Together, we tackle complex challenges and build connections that support good health in our region. In 2010, there were 14 people at the table. In those early days, organizations came together to learn how to work better with Island Health and vice versa, and how to unite as a region. We had no idea what this would grow into. Built on the collective impact framework and strong and trusting relationships, we have evolved into a connected community with hundreds of people working across many tables, and collaboration is now a part of our culture. We want every partner to see themselves as a critical thread in creating healthier communities. With the backbone support from our Cowichan We are aligned, united, and moving forward together. It is impossible to map every connection and outcome, but the scope of our collaboration is significant. We are one region, 5 local governments, 7 First Nations, and currently 77 active community partners under that overarching network, and more than 400 individuals engaged across multiple initiatives. We do all of this work with 1 facilitator, 6 leadership members, and an annual Island Health Service grant of $122,000. With that, we support coordination, data, communications, administrations, grant writing, and small grants for key community initiatives. Our initiatives span many areas, including the Elder Care Partnership in Cowichan, EPIC, the Climate Collective, the Community Action Team responding to the poison drug crisis, and youth services. We partner and support others with the Housing Coalition, Emergency Preparedness, Immigration Partnership, Physical Literacy, Collaborative Services Committee, Recruitment and Retention, Workforce, Access to Healthcare, and so much more. These efforts are all interconnected and address the social determinants of health in meaningful and practical ways. So what have we created? A strong and collaborative network where each partner brings unique strengths and resources. No single organization could achieve what we have accomplished together. Through this work, we have brought millions of dollars in services and programs and funding into this region, while also preventing significant healthcare costs. We have eliminated duplication and leveraged resources. And among our many partners, Island Health is present at every single level, from the leadership to the frontline staff. This includes directors, managers, public health, medical health officer, frontline outreach workers, and more. And I know we're not a big group tonight, but if you are in this room and you work with Island Health or with our Cowichan in one way or another, just put up your hand. So you can see the breadth, and the expanse of how we work in Cowichan. And what I would like to say is thank you, because we cannot do this without you. You are deeply appreciated, and we are so grateful to work alongside you. Now I get to highlight some of the fun stuff, and many of the examples what collaboration makes possible. First, support for vulnerable youth. Just a few years ago, resources for youth, especially those affected by homelessness and the poison drug crisis, were limited. For over 6 years, we have been driven to change that. Partners have come together to build a coordinated response, gather data, identify gaps, and advocate for change. And the result is extraordinary. We have secured millions of dollars in funding from provincial ministries and foundations such as the Misha Weiss Foundation with a $450,000 donation, and the community support through Coldest Night of the Year. And as a result, today, Misha Laylam Youth Shelter is opened, and it is owned outright by this community, and it is operated on behalf of our community by Canadian Mental Health Association. Island Health has helped us expand services through the Integrated Child and Youth Teams, known as ICY, and an innovative school-based health center at the new Khowutzun Senior Secondary. Our Youth at Home collective has grown to over 60 partners, and there's even more on the horizon with a big announcement to come along soon. Next, EPIC, our Elder Care Partnership Falls Prevention Campaign. In 2024, Partners in Health and Community co-designed a culturally safe campaign for older adults that combined practical strategies with broad outreach. It reached 30,000 people and contributed to a 13% reduction in hospital bed days related to falls in just 1 year. This $10,000 initiative costs less than one hospital stay, and it has now become an ongoing part of programming that we do in November. The team was also recognized provincially via the Health Quality BC's leadership in co-designing health with public and community award category. So toot toot. On a dark and stormy November night, just recently, there was a spike in drug poisonings. Overdoses exploded with individuals going down everywhere. 80 were reported in our community that night and early morning. This happened as the outreach workers were going home and the overdose prevention site was closing. Ambulances tending to the first calls could not keep up. Because of the extensive connections and relationships through our community action team, text, phone calls, and Facebook postings drew community partners into action. Naloxone was pulled from anywhere it could be found, and that included people's cars and their first aid kits. Volunteers headed out into the marsh and surrounding areas to save lives. This was one of our community's most tragic and traumatizing events, not only because of the overdoses, because it came in the same week as a large de-encampment took place and individuals were dispersed deep into the marsh and into the bush. But not one life was lost. What saved lives that night? By far, it was our years of collaboration and relationships and connections with peers and sheer determination. And we've learned a lot. And we've taken those learnings into developing new ways of communicating, a new peer, a new peer emergency response team, a better warning system for after hours, stronger and more aligned relationships with our 24-hour service providers. And this event was so significant, we can't tell you all about it now, but ask, because we've come together as a community. And finally, a personal story that reflects the power and compassion of this magical network, because we care. A woman fleeing violence with her young child had nothing but a few belongings and was ready to move from the woman's safe space into her very own apartment. A colleague in the RCMP reached out to me and asked me if I had any contacts that I could give to her so she could go and seek support. Because there was something really special about this woman. That same day, I reached out to the Our Cowichan Network family, and the response was immediate. Within one evening, every essential household item she needed was accounted for. Within 1 week, she had an additional $7,000 in gift cards, services, and even help moving into her apartment. And today, she and her daughter are thriving. And you'll be thrilled to know she actually works now for Island Health. And this is the boxes in my office that I just kept bringing home and the doorbell would ring. And so this opportunity lifted the spirits and connections across our network, and every one of us benefited. And so there's still so much work ahead, and we continue to build our momentum, and we grow stronger every day. And our current 3-year service contract with Island Health ends on March 31st, 2027, which is exactly 1 year from today. But with our collective strength and your support, we are looking forward to the next 10 years together. And why together? Because together we are the mighty. And it's not just what we're doing in Cowichan, It is how we are doing it that creates our superpowers and makes this work truly transformational. Thank you.
Thank you so much, Cindy. The very first time I came to a board meeting like this one, I heard about your organization, and I was overwhelmed then, and I feel overwhelmed again, so thank you to you and all the people who work with you in an effort to make this community healthy. It's wonderful work, thank you. So I want to ask my board colleagues if they have any questions before I turn it over to the floor. Ron?
Good evening, everyone. My name is Ron Rice. I'm from Cowichan tribes. My hereditary name is Wushk. And it is inspiring to hear about your work and to sort of lay it over top of Dr. Wan's comments around the social determinants of health. I think there is a lot of innovation in local ownership of work. There can be a lot of quality in community control. And I think the biggest part of this solution is the humanity and dignity and friendship that seems very present in everything that you do. And I think, you know, when people see themselves reflected in this is a solution, I am part of a solution. It's not I am a problem and I need this to happen for me. It's ownership, and I think that it speaks very loudly in this very short presentation. So I don't really have a question other than to say, you know, I think there is a lot of space in this kind of work to contemplate happiness and wellness as well as health. So thank you very much for all of your work.
Thanks, Ron. So I just want to now turn to the audience and see if there are questions from the audience. I'm a bit tickled that there are so many of you in the room who work with our Cowichan, and so there may not be many questions, but please feel free to ask a question or make a comment.
This is the network family. We use the word family a lot, and out in the community, those 400 other partners also know these folks and work with these folks. So it's our relations and our relationships and immense pride of all of you. Thank you.
Well, thank you very much. And you know, at Island Health, we call ourselves the Island Health family, and we value each and every one of the people who work with Island Health. So thank you for sending that woman to us and helping her so she could.
Be so proud of her.
Yes,
Thank you.
totally.
She now has a much bigger apartment.
Thank you very much, Cindy. So the floor is now open. If people want to ask questions, please feel free to do so. We have had some questions submitted online, and so I'll intersperse those with questions from the room. Thank you very much.
Good evening. Chris isn't here, but I really want to thank him for welcoming all of us to this beautiful territory. I also want to acknowledge Samoygadam Lahaga, that's the big chief in the air, creator of all life. And I also want to acknowledge the ancestors, and particularly the ancestors of this land, for allowing me to be here this evening. My name is Nola Jeffrey. I'm Tsimshian and Coast Salish. I was born in a small village about 20 miles north of Prince Rupert called Lakw'Lamps. I come from the Gitindaw tribe out of the House of Skagwat. My parents are Bobby Garner and Fred Dudeward. My maternal grandparents are Mercy Kelly and Robert Garner, and it's through Robert that I get my Stolo Coast Salish blood ties. And then my father's, Fred Dudeward, his parents are Frida Dudeward and Frank Goodenough, but my dad was raised by his aunt and uncle, Annie and Ernie Dudeward. I grew up in the village. I went to Indian day school. I was part of the boarding school system. I'm part of the Indian hospitals. I'm a sexual abuse survivor. So I've had lots of things happen in my life. I work for a beautiful organization called Sautin Lalem, and it's a Halkominam word that means helping house. Sautin Lalem started in the late 70s, early 80s, and became a society. It was the three families that came together, the Coast Salish, the Nuu-chonolth, and the Kwakwaka'wakw people. And they wanted something here that people call treatment, but Sautin Lalem, like I said, means helping house. We don't do treatment. We bring people into a safe environment so that they can do their healing. And this is survivors from the Indian residential school, from the day schools, from the scoop by the ministry, separation of families, missing and murdered, you name it, our people come. The historical genocide and the trauma that's happened to our people. We were in Snanawas territory for 35 years and recently moved down to beautiful Cowichan territory. Hello. 2 years ago, and I am going to get to my question, but I just want to give you context of who I am and why I'm standing here tonight. Before we moved down here, I had the honor and privilege of meeting Graham, and creator and ancestors actually stand and walk with me and help me do the work that I do to support our people in their healing. And they brought Graham and I together, and I didn't know that Graham was the chief doctor at CDH, and he didn't know that I ran a helping house or a healing house, and but we were meant to be brought together. I'd also heard that there was a lot of racism in Cowichan and in the hospital and the medical care center. That I am going to thank you, that I wasn't going to sit silent, that I wasn't going to allow our people to be treated without love and care and support and dignity and all those things that Island Health says that they stand for. And unfortunately, we've had some not so good situations when our people have gone to the Cowichan Hospital for medical help. I think everyone can hear and hear I'm emotional. I have a lot of emotion. I have anger inside of me in the way that our people to this very day can be treated and get treated with, it's inhumane. It is totally inhumane. I had a young man that came to me, not last night, but the night before, and he'd been using alcohol quite heavily for 6 months because he lost a friend to the toxic drug crisis, and that was the way that he knew how to cope with it. He went to CDH. He had been in the hospital in Vancouver. He had a prescription. He knew it was going to help him get through the detox. We take people at Sautin Lalem on in a program we call stabilization, but we are not a medical detox. We absolutely have to rely on the hospital to help us when we have a person that is in crisis. He went with the prescription. One of the ER doctors came out to a public area, told him, these pills aren't going to help you. You need to go out and buy a 10-pack of beer, and you need to wean yourself off of this. Go out and wean yourself off, and I am not giving you any medical help. Who does that happen to? Who does it happen to? It happens to our Indigenous people. And I have been working, and Graham has been working, and others have been working really hard to battle the systematic racism. And we're falling short. And we need help because we can't have our people been treated that way. Thankfully, I have a direct line to this man. I feel very fortunate that I do, and that he was able to give our relative the medical help that he needed last night so that he didn't end up going into seizures. And that was his big fear. He had experience with that. This is a young man that is very loved by his community, that has family, that has stabilization. But it doesn't matter, that shouldn't matter whether he has family that loves him or not, because he's a human being. And this isn't, I could go on and tell other things that have happened at the hospital, but I really think we need a way to find a way to make a real difference so that every person that goes into that hospital is treated with respect, treated with dignity, and gets the medical care that they need. You know, I've been sending cultural support to the hospital, not just for your patients that are in there, but for the staff, to try and help them understand that we have gifts, we have ways of taking care of things that can help somebody spiritually, mentally, emotionally, and physically. And I was hoping that would create an understanding. And I'm not sure if that's enough. I mean, Graham and I have talked about bringing the staff to South and Laleham, doing healing circles, and I sent him an email that he hasn't seen, that I said, I feel like it's enough talk. We need to have action, and we need to have funding behind that action plan. Because we've got this big, beautiful hospital coming, and our people are afraid to go to the hospital. There are some of my relatives I've had to take to Ladysmith because they could not tolerate the treatment they got at the hospital here. But I know it's not just isolated to here. I know it's something that is across the systems and in medical care. So I really, I appreciate the good work that's happening, and it's not enough. We have to make a difference. As I listened to the interim medical examiner do her presentation, I thought, what if she just did it on an Indigenous child? When people first came over here, our people lived a long time, and your people didn't. And the whole thing has flipped. And if we have elders, we're lucky to have elders right now, because most of our people die young. And it's not just from toxic drugs, and it's not just from accidents. We have probably highest rates of diabetes, of cancer, of arthritis, of all of those things that you say causes those health determinants, because most of our people live in poverty. I'm privileged, and I absolutely know that. But I care, I love people, I love our people, and honestly, there has to be consequences when people are acting in outright racist ways, like that ER doctor last night, and I would love to know his name. But honestly, I'm just not gonna take this sitting down. I'm not gonna allow our people to be treated that way. So I don't know if I missed anything. No. So I appreciate, did I miss anything? No. I appreciate you allowing me to stand here and speak my truth, and I really do want a way forward so that we can have respect for each other and walk together to make sure that everybody's health is important.
Absolutely.
So, thank you.
Yeah, thank you for your comments. Did you want to say anything, Kathy, about?
I guess I want to say I'm just so sorry, Nola. we shouldn't have to hear that story in 2026. I feel angry too, because there's so many people working so hard to try and shape this system, and it shows the impact of one person and one encounter. And I just need to say that there is so much work we need to do, and we're so grateful that there are so many people helping us walk this road. Your point about zero tolerance, absolutely agree. We've put in some processes in our patient care quality office, where we do have now Indigenous patient care quality person who follows up on those complaints. But that's after the fact. That's after the harm has been done. And that's not good enough. And to your point about building a brand new hospital, it's going to be one of the most beautiful hospitals in Canada. But if we don't change that story, that's a lot of effort and work that we have not been able to achieve the end goal that we're heading for. So there's a new, as of today, the Health Professions and Occupations Act. It's new legislation that's been implemented, enacted, which will allow for a much more transparent disciplinary process, that the members of the public can now make complaints about any regulated health professional in British Columbia. So there's another process, I guess, just to say that, outside of what the Health Authority will do. But I'd like to follow up afterwards. I'm sure Graham would as well, because we have ways we can actually investigate that and provide feedback to that individual to make sure that they know the impact of their encounter.
Great, thanks, Kathy. I think it's fair to say that the board is completely seized by this issue, and we are sickened when we hear about experiences like the one you're talking about. So Graham and others are helpful in making sure that we turn it to a different dial. And so believe me, we are trying really hard to do that, and I appreciate your comments. And are there other questions in the room? So I'm just going to read one that came through email. Bill M232 requires monthly reports on a home care wait list. What quality benchmarks is the board using to monitor the safety of both the client and their care partner during this wait? How will you ensure community care meets the same standards as facility care? And this is submitted by Eileen Record, an independent caregiver advocate for care partner rights and home care transparency, who's a resident of Chemainus. And James, I think you're going to...
Yeah, thanks, Leah. It's pretty difficult to follow the conversation with this question, and admittedly, quite shocked by what you've described, and I know that the teams here are going to follow up, so I'll do my best to answer this question. Bill M232 is actually the Long-Term Care Access and Transparency Act, and it's not quite law yet. So just to say, it has passed the second reading and is now being reviewed at the committee stage. If approved, we'll follow the Ministry of Health, will provide direction on how it will be implemented. I think the second half of that question was about what we're doing now to ensure that we have quality indicators and so forth in home care and home support or community services. Just to say at the system level, Kathy touched on a few of them early on. We do measure how many hours we provide communities by region at the system level. We measure how many hours are canceled or how many visits are canceled. We also have more qualitative measures at the more local level. And then I would just say that we obviously do measure the number of people waiting for long-term care and then how long it takes for those folks to enter. So we have quite a large group of indicators around the community health. sector, including how many of our seniors end up in unplanned hospital days. So I'll probably leave it at that.
Thanks, James. Any other questions from in the room, within the room? Every once in a while, somebody looks like they want to, and then they don't. I'm sorry? Yes, please.
So just getting back to Nola's presentation and question, it is something that I'm finishing my 6th year on this board. I arrived in the summer of 2020. The pandemic was in full rage. We were isolating, we were hoarding at grocery stores. There was no vaccine in plain sight, hadn't even reached its first draft. And this conversation has been happening at this table for all of the years that I've been present, and sort of laying truth that the In Plain Sight report is not a magic wand, and the policies that we impose and implement are not the full solution. The reality is the policies that we're putting into practice will have an impact someday. The reality is this is still happening in hospitals all over this country. And we are trying to collectively create a system where we can stand in a room together and speak the truth out loud in a way that might not have been possible 10 years ago, or 20 years ago, or 50 years ago. So it's really hard to look at yesterday and tomorrow and see the needle move at all. But if we look back at where things have come from, we can start to see that there is incremental progress happening. It doesn't help your friend. It doesn't solve the problem. For people who don't know, so you know Graham, but your friend knows you. Not everybody has access to Nola Jeffrey. So the reality is we need to build a system where people feel comfortable saying things out loud and not being labeled a troublemaker or a complainer. I am here to report that the standard of health offered to me has fallen below everyone's standard. So I think it's important that you always feel comfortable being emotional here, presenting hard truths here, saying things out loud to people who are inside the system as well as outside the system, and making sure that something is done. And so I didn't want to carry on without saying that this conversation is happening over and over again, and we have heard some pretty horrific stories, and understand that the system that we are building right now doesn't mean there are going to be fewer incidents. It just means we're going to hear more and more things that we find offensive as a collective, where they might not have been said out loud before, because that mother would have just left the ER with her children, or that man would not have even gone to the hospital to begin with and would have just suffered until it was too late. So I think it's important. I just wanted to respond and just say that this is a conversation that we have very often at this table. So I wanted to thank you for your presentation, Nola.
Thanks, Ron. So I have another question that came in via email. Will the board integrate a care partner bill of rights into the Section 5 annual access plan? Specifically, will this include the right for caregivers to form independent care partner councils with a mandated seat at the table for home care oversight? And I think, James, you are going to answer that as well.
A lot of legislative questions here. I'm afraid this one's similar to the last one. So there is no Bill of Rights for home care clients at this time. the ministry and legislative bodies like that will make a decision whether or not that makes its way into the system, and we will follow that direction if it comes.
Thank you. I don't want to keep reading these if there are questions in the room, so I'm just giving you a chance to put your hand up. Because then there's another question. This question's from Heather Ferris. How is Island Health ensuring that people living with dementia are treated with compassion and dignity across all care settings, and that families are meaningfully involved in care decisions, especially during transitions between facilities?
I may ask my friend James to answer this one as well. I think the question is really, how are we facilitating patient-centered care as patients are moving from one facility to the other? Yeah. How are families meaningful involved in care decisions? I think that the commitment to patient-centered care is part of the values that we have at Island Health. And we also know when people are moving from one care setting to the other are often the areas where gaps occur. And we have difficulties in information transfer and changing the care team. So we have to pay special attention to those, what we call transitions in care. The families play such an important role in those transitions because they can be the steady person, the people who are there no matter what environment the patient is in. And they actually are critical to being able to develop a comprehensive plan of care that covers all of the needs of the patient and not just the medical needs or what's being seen in that particular environment. And I think that, we have case managers who actually bridge those transitions between hospitals and home, or hospitals and long-term care, to make sure that they develop that relationship with families. And through that relationship, the families are engaged in developing those comprehensive care plans.
Thank you. Any comments from the floor yet? Someone, I don't know your name, but I loved it when you clapped. And I see you smiling now, so. And I have one more question then that came in. And it's very similar to the question that was asked about anti-Indigenous racism and Indigenous-specific racism in the system. And when you talk about that and how horrible it is for Indigenous people to get care, honestly, it makes me want to cry. And I really wish that we could just go like this and turn it around in a day, but it's not going to happen, and we are working on it. And so I'm really grateful that you got up and talked about that, and I'm grateful for people like Graham who understand and who care for people, and no matter what. So we'll keep trying, and we'll hope to do a better job sooner rather than later. But if you tell us about it, it helps us get a grasp of where it is, why it is, and what we can do about it. So I mentioned, I'll give you back this. I mentioned at the beginning that we were a governance board and that we are accountable to you and the people we serve in the number of communities that Island Health provides care in. And that's why it's so important for us to provide opportunities like this to hear from you. Thank you to everyone who asked a question and to those people who submitted questions online. I hope we've addressed some of your concerns today. Please be assured we are actively listening to your needs and concerns regarding your health care. Thank you to Kathy, Melissa, and Cindy for your presentations. And to all of you who came today or tuned in on our live stream, we very much appreciate understanding what your issues are. And I want to before I end, just point out our multimedia group over here behind the big lights and the banging noises, that we're very grateful to have this group who can help us make sure that people can come online and hear from us and set up our room, and so thank you very much for that. And the forum is closed now, so thank you for taking time to join us today in this really rainy weather.